Shelby is a young Chihuahua puppy that we saw on the Cardiology Service for a heart murmur. Shelby was diagnosed with a PDA, which stands for patent ductus arteriosis. And this is a congenital heart defect that can result in the heart becoming enlarged and ultimately fluid building up in the lungs. This is a big problem, fluid in the lungs. We call that congestive heart failure, and ultimately can be fatal. Once it's diagnosed, the treatment is to close the vessel. There are two ways that we can approach this closure. The first way is through a surgical procedure that requires a surgeon to open up the dog's chest, find the abnormal vessel, and put a suture around it to close it. This type of procedure is very successful, but it's also quite invasive, and there's quite a bit of pain associated with it. Shelby is only about 4.5 pounds, so he is typically of a size that would have had to have the open chest procedure. However, we came up with a plan to try a new device that would go through his vein instead of his artery. And this allowed us to go through Shelby's femoral vein, which is a little bit bigger and more flexible than the artery. And so we could place a catheter in his vein, even at his very small size, and use the new device called an Amplatzer vascular plug, or AVP, to close his PDA. There's typically a very quick recovery after surgery from these procedures because we're only making a very small incision in the leg. Shelby woke up from anesthesia and spent one night in our ICU and then was able to go home the very next morning. The prognosis for dogs once their PDA is closed is excellent, and we expect to live a normal lifespan. The impact of having this procedure with this device in our toolbox means that we can use this minimally invasive approach to close PDAs in very small dogs in the future, ones that would have had to go the more invasive route in the past.